Production support for InFocus is provided by Smithville, a locally owned business serving central and southern Indiana since 1922 with residential and business internet, voice, and security services. Smithville, local pride, global technology. Information at smithville.net. Hoosier Energy, providing electricity for central and southern Indiana electric cooperatives and their member customers. Information at hepn.com. And by viewers like you. Thank you.
This month marks 20 years since the signing of the Americans with Disabilities Act, which prohibits discrimination of people suffering from various disabilities. Many of those people rely on Medicaid for financial help. In fact, more than 50 million people are enrolled in the Medicaid program nationwide, making it the nation's largest health coverage program with an annual budget of more than $300 billion. But experts say many people are still not receiving the support they need. Is Indiana's $1 billion budget enough, or must funding levels be increased in order to shrink the number of those struggling without benefits? We'll explore these and other issues tonight as we put the state's Medicaid Waiver program in focus. Thanks for joining us for In Focus. I'm Stan Jastrzebski. If you have questions for one of our studio experts this evening, you can email us at infocus@indiana.edu or call us toll-free at 1-800-987-9848. Thousands of Hoosiers are unable to pay for the care they need, in part because Medicaid funding is running short. Though Medicaid is supposed to provide long-term care services for individuals living with disabilities and the low-income elderly, WTIU's Shamika Neely reports an already long waiting list for benefits continues to grow.
Indiana is the most populous state to eliminate institutionalization for people with developmental disabilities. Stonebelt Executive Director Leslie Green says that since the change, the state has saved more than $95 million. But she says it's vital that money goes back into community-based services. But with more state and federal Medicaid dollars, organizations like Stonebelt and the people those organizations serve are still coming up short.
A Medicaid waiver is a funding source for someone who wants community-based services. A Medicaid waiver won't pay for an institutional type setting. It pays for people to live and work and recreate and learn in the community. Each person that has a Medicaid waiver has a certain allocation or a budget amount that they can spend, and they can buy services with that. Some of them need 24-hour, 7-day-a-week supports, and agencies such as Stonebelt provide those supports.
Currently, 17,500 people are on Indiana's Medicaid rolls at a cost of $1 billion annually. Governor Mitch Daniels has mandated cuts to the budgets of all state agencies, and about $30 million has been slashed from the Medicaid waiver program, according to ARC of Indiana, which advocates for those with disabilities.
Indiana actually is the largest state per capita that has no institutions for people with developmental disabilities. So that's something I think the state can feel very good about. We want to make sure that the monies that were saved from closing those institutions continue to be put into community-based services, because was money that was dedicated to those individuals, and it should follow them out into the public.
An estimated 22,000 people on the waiting list to receive Medicaid benefits in Indiana, and ARC of Indiana Associate Director Kim Dodson says there's potentially hundreds more who haven't surfaced. She believes even in a recession, home and community-based services are in the greatest need of funding.
And again, I think we have already cut as far as we can cut without really hurting individuals themselves who are receiving services. So I think that we really need to be working side by side with the administration to see what other avenues exist for more money to come in. Again, I think we need to look to other states of how other states are really responding to this, see how they are managing things differently, because it is not working well in the state of Indiana right now, and we are really in a very difficult financial time.
Some families have been waiting 10 years or more to receive benefits, and now with stimulus funds depleted and federal dollars short, agencies aren't sure what's next. We'll discuss this in detail as we put Medicaid in Indiana in focus.
And joining me tonight are John Dickerson, the Executive Director of the ARC of Indiana, Maureen Gahan, who is Director of Stone Belt's Milestones Program, and Dr. David Orentlicker, a former state legislator who is now co-director of the William S. and Christine S. Hall Center for Law and Health at IUPUI. Thanks everybody for being here. And John, I want to give you the first question. Tell me briefly about the Medicaid Waiver Program, who's eligible for it, what does it provide for, things like that.
Stan, Medicaid is one of the most important programs in Indiana. It's a shared federal and state program. 75% of the money comes from the federal tax dollars, 25% from Indiana. It covers low-income Hoosiers who are elderly, disabled, and have no health insurance. It also provides long-term care, which is essential, and that's part of where the Medicaid waivers come in.
David, let's talk a little bit about your time in the state legislature dealing with Medicaid. What about the state legislature's dealings with it did you interact with, and do you believe that the state legislature is on a good course to try to provide the funding that is needed, whether it be getting the matching funds or dealing with the state's own implementation of programs?
Well, one of the unfortunate realities is when we have a tight budget and we are going through difficult economic times, that the legislature looks for programs to cut, and we cut far more than we should. This is a bad area to cut because, as John said, we don't pay the full cost of the Medicaid program. Traditionally, we paid a third. Now, because of the stimulus dollars, we pay a quarter. So when we cut $1 out of these Medicaid waivers, we're actually cutting $3 or $4 because of, so it's kind of a penny-wise, pound-foolish approach. Why forego all these federal dollars? And other states do a much better job of drawing down federal dollars. We have chronically underfunded our Medicaid program when you have this long waiting list, and you know, this is one of the unfortunate realities nationally. When you have federal-state partnerships, they just don't work as well. Medicare, who has trouble getting into Medicare once you're 65? But all these people who should be covered by Medicaid don't get covered, and you know, this is beyond the scope of this program, but it should be a federal program, but here we are. You know, as I say, the General Assembly looks for areas to cut, and this is a way where, as I say, we should be cutting in areas where we're not losing federal dollars, not where we do it here. But, you know, as a legislator, what I think they'll tell you is there are lots of important needs. There are the people with developmental disabilities, there are people with mental disabilities who are underfunded, and, you know, we need to, and in tough economic times, what you end up with is too many people fighting for a shrinking pie when what we really need is a growing pie. I
want to ask Maureen about that. When funding from Medicaid gets down to organizations like Stone Belt, is there enough of it at the moment to make it go as far as you and your organization would like to see it go? Does it cover enough people?
Well, with these latest funding cuts, we got our employment program was cut 10%, the rates. Our waiver program was cut 7%, and our group home program was cut 3%. We're serving the same people with the same amount of need with $750,000 less dollars. That was the impact to Stone Belt. And that's very, very difficult to do. One of the things that we did, I'd say 2 months ago now, we looked at how can our agency, it's a not-for-profit organization, we're using, I think, every dollar wisely as we can, how can we sustain a $750,000 loss? What we did was we looked at our administrative costs, we cut administrative positions, then we started to look at services, and we tried to keep the cuts as far away from our consumers as possible. But with that amount of cut, that was very, very difficult to do. So the impact to the participants of our programs, we have to do less individualized services, we have to do less services for some people, we had to eliminate some programs, reduce some programs. 2 years ago, this is not the first cut that we've had. 2 years ago, we took another financial hit, not as drastic. If you went to Stone Belt over at 10th Street, you would see individuals coming and going all day long. They had jobs in the community, they were volunteering, they had all kinds of leisure and recreational activities going on, and now we can't provide that level of service or support. So,
well, let me ask you about that. Are there people, each of you